Hello, my name is Linda Okafor. In this week 6 journal, I encountered a particularly impactful case involving a 32-year-old female presenting with symptoms of psychosis for the first time. The patient had no prior psychiatric history and came in accompanied by her concerned family. She exhibited severe paranoia, auditory hallucination, and disorganized speech, which had developed rapidly over the past 2 weeks. Her family reported that she had been under considerable stress due to a recent job loss and a significant breakup. This case enhanced my understanding of the role of the psychiatric mental health nurse practitioner in several ways. First, it highlighted the importance of conducting a thorough and comprehensive assessment. The lack of prior psychiatric history and the acute onset of her symptoms necessitated a detailed evaluation to rule out any underlying medical conditions or substance use that could have contributed to her psychosis. This experience underscored the role of the psychiatric mental health nurse practitioner in differentiating between primary psychiatric disorders and other potential causes. Additionally, the case reinforced the critical need for family involvement in the treatment process. The patient's family provided invaluable collateral information that helped piece together the timeline of her symptom onset and stressors. This emphasized the responsibility of the nurse practitioner to engage families in the treatment plan and support them as part of the therapeutic process. Witnessing her acute psychosis firsthand deepened my understanding of psychopathology, and particularly regarding how stress can precipitate severe psychiatric symptoms in individuals without a prior history of mental illness. It highlighted the complex interplay between psychological stressors and biological vulnerabilities, which can lead to emergence of psychotic disorder. The interaction between patient and her family taught me a lot about building trust and rapport in a crisis situation. Patient was initially very mistrustful and agitated, making it challenging to conduct the assessment. By approaching her with a calm and empathetic demeanor, validating her experiences without judgment, and ensuring her safety, I was able to gradually build a therapeutic alliance. This case highlighted the importance of patience, active listening, and nonverbal communication in establishing a connection with patients experiencing severe psychiatric symptoms. Reflecting on this experience, I recognized several personal strengths and limitations that impacted provider-patient relationship. One of my strengths was the ability to remain calm and composed in a high-stress situation, which helped in de-escalating patients' agitation. My empathetic approach and effective communication skills also facilitated trust building with both patient and her family. However, I also identified a limitation in my initial hesitation to ask probing questions about potential substance use or trauma history due to concern about exacerbating her paranoia. This reflection made me realize the need to balance sensitivity and the necessity of obtaining crucial information for accurate diagnosis and treatment planning. My therapeutic use of self was crucial in this case. By being present, actively listening, and showing genuine concern for her well-being, I was able to create a supportive environment that helped alleviate some of her distress. I learned that my presence and the way I communicate can significantly impact a patient's experience and engage in treatment. One significant learning from this case is the importance of integrating a biopsychosocial approach in assessment and treatment planning. Understanding the patient's life context, stressors, and social support system is essential in addressing their psychiatric symptoms holistically. Moving forward, I will apply this learning by consistently incorporating comprehensive biopsychosocial assessment in my practice and ensuring that I consider all aspects of a patient's life when developing treatment plans. Thank you.